Hello everyone, and welcome to The Public Good. I am Deja James with Partnership for the Public Good. I am Director of Policy Advancement and Media with PPG. We are a community-based think tank of over 350 community partners trying to make a better Buffalo through policy, through research, through policy development, and also civic education and engagement. I'm really excited. We have the show every Tuesday. You can tune in, see it on video, listen to it on podcast, check it out. And today I am here with someone who's actually going to be a part of our community agenda process this year. And if you don't know, PPG does an annual community agenda process where we hear from the community what changes and what policy they want to see in their own community. So we do not come up with the policies that we work on. We completely guide that by community voice. And we have this process in which, if you've heard of pitch competitions like Shark Tank or different stuff like that, you can pitch a policy idea that you think is going to better your community. And so we want to make sure that we're doing that. And No Menthol Buffalo, which I am here with today, or the representative of, is going to talk to us a little bit about an agenda item that's come up this year, but you've actually also, or No Menthol, the cause has been on our radio show before. But I'm really excited to have you all back, have you in the community agenda process. Because I don't think people think, well, not that people don't think about it. I think that a lot of time when we're in policy work, we don't always focus on public health initiatives when we think about policy change. And we don't think about the systems behind like our health systems and things like that. And so I'm really excited to have you on today to kind of delve deeper into that and to hopefully shine a light onto that topic for people in a way that's like accessible. So I'll let you introduce yourself and finally stop talking. Sorry. But please, if you could introduce yourself and the campaign you're a part of.
Sure. So I'm Dr. Schuyler Lawson. I'm with No Menthol Buffalo, and I'm lead of the research and evaluation team.
Yeah. And so you said you're a doctor, so I have to like always give people props for that. But what is your research in specifically, and how did you get involved in the No Menthol Buffalo campaign?
So to your first question, my research, it revolves around tobacco, like, finding ways to help people quit, looking at differences in like rates of illness and disability between different groups. Mm-hmm. So, and that's called tobacco-related health disparities. Yeah. As well as tobacco control policies, thinking about things like limiting flavors or bans on smoking outdoors. Those type of policies that help cut down on preventable illnesses and deaths related to tobacco.
Absolutely. And so what exactly is No Menthol Buffalo focusing on? Because there's a lot of different campaigns against like the tobacco industry and things like that. So what exactly are you all asking for in this moment?
Right. So No Menthol Buffalo is a youth-led and community-led movement, and we're specifically asking for the Buffalo Common Council to put forth a ban on the retail sale of menthol cigarettes and other flavored tobacco products.
And so why are you focusing so much on the flavoring of tobacco products? And I've heard before why, but I want people to really understand like how essentially addictive the flavoring makes it, all on top of the nicotine, on top of the other things that are already happening. But why menthol specifically, and what is it about menthol that hooks people?
Right. So you can think of flavors like, for example, we'll focus on menthol. They sweeten the poison. They make smoking a lot easier to do, as opposed to having a harsh tobacco taste. It's more of a cool, refreshing sensation, kind of like in toothpaste, because toothpaste also has menthol or peppermints. So it makes it a lot easier for youth to start smoking. And it also makes it harder to quit as well. And there have been multiple research studies that have shown that people who smoke menthol cigarettes compared to people who smoke non-menthol cigarettes, they have a harder time trying to quit, even though they make more quit attempts.
Really?
So the flavoring component, it makes it more appealing. And even the way the menthol interacts with the nicotine, it may be even more addictive than just non-menthol cigarettes.
Wow. And I don't think people think about that the flavoring is adding to the addictive quality. I've heard before that people have a hard time smoking because they like the physical movement, they like the camaraderie of a smoke break, or like some of those other things are addictive. But I don't think, and I think people have I think there's been active campaigns against tobacco use for a long time, especially like my generation, the no smoking thing. Like I've never touched a cigarette because it just, I don't know, it must have worked for me. Yeah. But like, growing up late 90s, early 2000s, it was like, no, we're trying to get rid of that. We're getting rid of smoking in Denny's. We're getting rid of smoking in restaurants. It's all changing now. Smoking culture is changing. And then it seems like they added flavors, they made it fun, they put fun commercials up, and now like there's vaping and different things like that. And so it's almost like this rebranding of something, that's deadly. I'm wondering, specifically for menthol, is that a new thing, like how vaping and grape flavor and all these other things are new, or has menthol been around way longer than we kind of think about?
I believe menthol cigarettes date back to like the 40s and the 50s.
See, I didn't even know that.
Yeah, the issue that we mainly have with menthol as a flavor in cigarettes is that all of the other cigarette flavors were banned except for menthol, which is a huge issue because menthol is disproportionately smoked by Black Americans. About 85% of Black Americans who smoke menthol cigarettes, and it's no coincidence why that was kept. The flavor was kept in the law as opposed to being banned, because that's a big part of the tobacco industry's market share. Whether it be through Cool Cigarettes, Newport Cigarettes, Salem, all those major menthol cigarette brands, there was some lobbying put forth to make sure that flavor stayed in place, which is a big racial injustice issue, because if you recall, when it came to vaping, and when the majority of people who were vaping were a lot of them were young white kids using flavors, there was a national outcry like this needs to stop, and there were pushes for flavor bans, but that's never happened with menthol cigarettes. Nor has it happened with little cigars like Swisher Sweets and Black and Mild, which also have flavors like grape and fruit flavors, and they're just as deadly as cigarettes. And they're used disproportionately by Black youth, but there's not the same national outcry. So that's why we're kind of pushing for this issue to be addressed, because it's been ignored for decades.
Like I'm like stunned as you're saying. It's like when I really think about it, because it's similar to like the opioid crisis to me, of like, oh well, now white middle class America has these pills and now it's an issue. Now we're scared. Now we need to help people. Now we need to do more restorative practices for drug addiction and all these other things.
But not for the heroin epidemic or the crack cocaine epidemic.
Right.
That was completely, they needed to, they were given incarceration. Now currently with the opioid epidemic, now there's more of approach towards medication. Like for example, in Buffalo started the very first opioid intervention court, where the idea is that instead of just incarceration, try to apply treatments and try to actually treat the root cause of the issue as opposed to just doing incarceration. But that mindset was totally absent from heroin epidemics or crack cocaine epidemics in Black communities. So it kind of goes back to, it really depends on what community is being impacted. That kind of heavily influences the response, whether it be a public health response versus a criminal justice response.
Absolutely. And I love that we're talking about this now, because what you're asking for with No Menthol is considering all of those factors. So even though you're trying to get rid of the sale of menthol cigarettes, you're not trying to criminalize the users of menthol cigarettes. And so I want that to be completely clear and transparent, because I think some advocacy groups and some people who try to affect policies try to come from it from a punitive angle, and that's very much not what your campaign has done. And I think that that's very valiant of you all, especially because you already know the racial sensitivity of the issue, but you're really trying to focus on the vendors, the corporations, the companies,
retail manufacturer, not possession.
Exactly. Trying to make sure it kind of like just cutting off that pipeline and the access to it. And so is your hope then that if we're able to get rid of this menthol cigarette, then we're going to see a decrease in the rate of tobacco use, and then therefore tobacco related illnesses and things of that nature?
Yeah, the hope is that it'll be a decrease in the number of youth who initiate tobacco use, as well as an increase in the amount of people who are actually making quit attempts and successfully quitting the tobacco products due to the flavoring issue not being so addictive.
And how, I guess my other question is, with the flavoring keeping people addicted to this substance, I don't know if younger people know anymore how dangerous nicotine and tobacco are. I don't know if you can speak to that a little bit, of what happens if we don't? You know what I mean? What are the consequences if we don't get this off of the market?
Well, I mean, currently about 45,000 Black people die each year from tobacco-related illnesses, and that's projected to continue without this issue being addressed. So that's kind of what we're looking at, is more preventable deaths It could be
45,000
45,000
every year.
every year.
Completely preventable.
Completely preventable, and the really shocking thing about it is that Black people smoke fewer cigarettes on average than most other racial groups, but there's so many other kind of compounding factors that are at play. For example, Black people have the highest rates of secondhand smoke exposure. Because, for example, there's a lot of Black populations that live in areas where there's not comprehensive smoke-free air laws, especially in places like the South. There may still be you still smoke indoors in certain places, or if you live in, say, an apartment complex or some kind of residential area like that, it doesn't have smoke bans like that, and you're exposed to secondhand smoke and thirdhand smoke. The tobacco smoke also can stay in furniture or other items too. So there's that increased exposure. There's also the fact that Black communities have a disproportionate number of tobacco retailers. I mean, you look on the east side of Buffalo, you see just the density of tobacco retailers is all over the place, and combine that with there being a lack of an adequate number of grocery stores. If you're a kid and you want to get some food, well, you're going to go to a corner store. You're going to see tobacco products probably every day if you're going every day, because where are the tobacco products, where are the tobacco ads? Right behind the register.
Right.
Not by accident. So all these factors kind of combine, and they lead to this preventable health disparity where tobacco-related illnesses are affecting Black people more than other racial and ethnic groups in the United States.
Oh, that's just so tragic, especially the impact on young people, especially in that impressionable age, because I remember going to the corner store all the time. And beyond that, I was picking up the cigarettes for my grandmother or whoever, go to the store. I'll give you can take $2 to get what you want. Get me this pack, whatever. And I knew how to get her cigarette order from 8 years old. You know what I mean? And then I'm holding them, and then I'm walking home with them. And then, so I'm floored by just that pipeline of just such easy access and exposure and what that does. What has the tobacco industry's response been? Because this is not just a local campaign. This is national campaign. Yeah. So what have been the challenges in you all advocating for this, and what has been, I guess, their rationale behind possibly not doing something like this?
The biggest challenges have been is just fighting against the tobacco industry's narrative that it will lead to increased policing in Black communities, which is not true, because we just talked.
They're trying to flip the narrative of we're trying to protect social justice and not be punitive. Oh wow.
Yeah, because they're preying upon legitimate fears in the Black community about policing, but at the same time ignoring the fact that the law does not criminalize possession, so that wouldn't be an issue.
That's appalling.
It is, but again, I mean, the tobacco industry's main goal is to make a profit, and a menthol ban would threaten their profit, so they'll do whatever they can to maintain it, even if it means spreading misinformation and exploiting legitimate Black fears.
Yeah. So how are you all kind of working on a counter narrative to that? You weren't joking when you were saying that your group is led by youth, by adults, by community. It's very grassroots. How are you able to kind of generate this support and network for this cause? What is your kind of structure of how you're going about your advocacy right now?
A lot of community engagement, activities like this, going on podcasts, going on radio, as well as partnering with other community-based organizations that work with youth and adults, and a lot of tabling, really just tabling at different events to actually talk to community members about what we do, and kind of just explaining, hearing them out, and then kind of explaining what we do and how it relates to their public health.
And is it well received? Because I think that especially Black people get a bad rap of we don't know how to take care of ourselves, or we're not, all kind of terrible, disparaging things. What has the reception been from young people, from even older people, or maybe people that are trying to quit? Are they receptive to kind of the information that you're putting out there and things like that?
Largely, yes. I mean, we've been doing petition drives at every event that we table at, and we get a lot of signatures. I mean, we have about 1,000+ petitions that we sent to Buffalo Common Council members and the mayor's office, as well as we had a survey running for about a year, kind of gauging people's attitudes about how they feel about a menthol ban.
Well, I'm interested in the survey. So how did you guys kind of get that out there, and what did the survey entail? What were you seeking from that survey?
So we got it out there through 2 ways. We had a digital version people could scan the QR code, access it that way, or access the link. And we also have paper surveys because we wanted to reach across generations because everyone's not everyone's not tech savvy, so we want to make sure we're getting everybody we can.
Right.
So for the paper surveys, we have stacks available at tabling events, so people would fill it out for the chance to win a gift card. And we were looking at things like kind of how do you feel about would you support a ban on the retail sale of menthol cigarettes? Do you think that banning menthol cigarettes would increase people's chances of making a quit attempt? Are you concerned about menthol cigarettes' impact on youth, as well as are you do you support banning the retail sale of menthol nearby schools and other places that are kind of frequented by kids? So we ask questions like that to get a sense of how they feel. And then we also collected things like age, race, gender, just to kind of get education to get a sense of just different demographic differences.
And I'm always curious because PPG releases reports and different things like that. Have you all released any, publications or materials from just some of the research that you've all been doing, or is that the plan? Just wondering if there's kind of anything you guys are putting out there.
The larger plan is to come up with like a comprehensive report, kind of breaking down some of the main findings. But we have done community forum events where we go to different places. Like we did one at the Merriweather Library. We've done one at Roswell Park's Community Outreach Center, where we invite community members to kind of hear about some of the key findings. We have like a PowerPoint slides. We have a discussion about the findings and what they mean.
That's amazing. And you do a lot of different community engagement events, and you all sent me a few that you might have coming up. So I want to give you the chance to be able to talk about those. So it says we're going to have a community forum at Roswell Park. It says you are going to have a No Menthol Buffalo funeral, or maybe you've already had that funeral.
Already had it, yeah.
What is that? Actually, I want to start there. What is a No Menthol Buffalo funeral?
So the No Menthol funeral it's been done before, but it's an event where you have an actual casket. You can fill it with different types of tobacco products. So we filled it with menthol tobacco products and like other types of like flavored little cigars, and we have people give eulogies and give their testimonials about how they've been impacted by menthol tobacco. We even had we had local faith leaders kind of give a eulogy, and just kind of it was sort of a call to action because it was right in front of City Hall in that small park, Niagara Square.
Yeah.
So we had the casket there, and it was just kind of a gathering and people were just talking about their experiences and how they were impacted by menthol tobacco. We also used the opportunity to collect more signatures for the petition drive.
And that's powerful to me, especially after you've said that statistic and that number of the 45,000, it's similar to me, like when COVID came and all these people, a mass amount of people are passing away. And it's like, how do we grapple with and process and memorialize and all of those things, something where we've kind of just had to push past it, get through and just, okay, we still have to function anyway. I think that's very much how our community gets through things because we have to. But it's important for us to take those moments of mourning, of memorialization, something like that. It's so, it gives me that feeling of like that Emmett Till, like the reason why we, make a public display is because we have to give ourselves and the world, honestly, a reminder and a denotion that like we're here, there's something impacting us, you can't ignore it.
Right.
Yeah. So I love that you all did that. Have you had any great reception from local authorities or politicians that you've been trying to kind of rally around this cause? Obviously, you're calling the Common Council to act on this. What has been the reception from the Common Council so far?
I guess negative to neutral, largely neutral, but we do have one champion. That's council member Rashid Wyatt of the University District. He's openly supported the No Menthol Buffalo movement, and he was even present and gave a speech at the No Menthol Buffalo funeral.
Wonderful. And we want to thank Councilmember Wyatt for doing that. Just wondering if you've gotten any other feedback of like what is the hesitancy been for any of the other council members trying to figure out if they want to support this or not.
Yeah, some of the hesitancy has been concerns from the business community.
Okay.
Regarding maybe a loss of sales.
Okay, like from the corner stores or the different owners and things like that. That's interesting.
Yeah.
And to be clear, this wouldn't ban the sale of tobacco products in general. It just would be specifically flavoring. okay.
Yeah. And we just also have some concerns about whether or not those products are even make up even a large percentage of their sales anyway.
Yeah.
Yeah, because they also sell other things like food and beverages and
at sometimes marked up rates, but we will not get into
Yeah.
that. So I'm going to stay on a positive note and go into some of the other events that you possibly have coming up. It says Great American Smokeout, your community forum. So what is your advocacy looking like going forward, having some of these community events? I know you said your future goal is possibly releasing a report, but how do you feel you're going to move forward trying to continue championing this and getting the council to move on this?
Just more, I'd say more community events. And also we've even appeared on Daytime Buffalo.
Amazing.
To talk about the No Menthol Buffalo movement. So just keeping that exposure going, as well as we also had a billboard and a bus shelter campaign.
That's really good.
Yeah.
A lot of people are seeing those lately too. I remember when I was younger, sometimes there would be a current ad in there or not, but they've been doing really good. And I think a lot of policy and advocacy groups and campaigns have been doing great utilizing those. So I'm happy that you all are up there. How can people get involved or kind of check in with you guys if, they've been impacted or they also feel passionate about this or want to help? How can people, get in contact with you all or help with this campaign?
Sure. There are a couple of ways. So we're on Facebook. If you type into Google on, No Menthol Buffalo, your Facebook will pop right up. We're also on Instagram. So, No Menthol Buffalo, you type in Instagram into Google and it should pop up. And we also have an official website called nomentholbuffalo.org. And on that website, you can actually take action by filling out an online petition, and based on your zip code, it goes to your Buffalo Common Council representative.
Amazing. So we look forward absolutely for you all being a part of the community agenda process too. And I'm hoping I can look forward to working with you all in the next year on this. I thank you so much for your expertise and trying to educate the community. And I just wish this campaign so much good. I was so excited when I heard, or it was illuminating rather, to hear Stan talk about it initially when I first met him, and then when he was initially on the radio show. And I've heard some of the statistics before, I've seen it in some of your application, but it's just still so jarring to me. And I just keep wanting to repeat that 45,000 number because I just don't. Sometimes we see a lot of numbers, we're on social media, we see a lot of things, and we can be desensitized to that, but that's 45,000 human beings that are dying every year for something that's completely preventable.
Yeah, I mean, something that you and the listeners can kind of think about, especially if you grew up reading Black print media like Ebony, Essence, or what is it, Jet magazine.
Yeah.
Do you remember seeing the tobacco ads in the magazines?
Full page.
Yeah, there's been decades of systematic targeted ads in Black communities, all in print media, billboards in Black communities when it was legal, as well as even a whole jazz festival devoted to selling tobacco products to Black people called the Cool Jazz Festival.
Wow.
Look it up. It's been a very concerted effort, even a while back, giving donations to the NAACP, HBCUs. There was a lot of efforts to really push tobacco products in the Black community, even to the point of sometimes giving away free samples to members of the Black community at events just to get them hooked.
And people try and undersell us on the power of our dollar, of our drive on the economy, of our drive in elections. We have a lot.
Yeah.
They're targeting us for a reason. We are a large demographic in America, and we have more power than we think. And I think this is one of the cases in which we can really take our power back. To your point of the full page ads in Jet and Ebony and things like that, those used to be the coolest ads you would ever see.
Yeah.
I mean, and it would have the celebrity of the time or the basketball player or the, and I feel like I'm seeing it now again with sports betting and stuff like that.
Yeah. It's the same idea. Yeah.
It's the same copy paste formula. You know what I mean? So I want us to stop buying into it. So once again, I appreciate you so much for coming on, talking about such a salient topic. And I hope the listeners can learn. Please plug into No Menthol Buffalo. We really want to see a change in our community, and we want to save lives. So thank you so much, Doctor, for being on with me today. This has been The Public Good with Deja James from PPG. Please tune in every Tuesday on any podcast platform or on our YouTube page, PPG Buffalo. We thank you so much, and we will see you again next week. Thanks.